Please welcome to the stage Jenelle Krishnamoorthy of Merck and Anuradha Gupta of Sabin Vaccine Institute.
Good morning. Welcome. So glad you all are here in person and then online to really discuss today a critical topic that I'm thrilled that all of us can get involved and actually achieve the WHO goals. So we're here to talk about cervical cancer elimination. This is an issue that the WHO says is the most common cancer, fourth common cancer among women globally. But what's really exciting, there's something we can do about this. We can eliminate cancer in the cervical cancer as WHO recommends. They say screening, treatment, and vaccination are the key to make the goals of 90, 70, 90 targets. And I'm so thrilled to be here today with Anuradha Gupta, the president of immunization at Sabin Vaccine Institute, and seeing how we can really learn from you and your great leadership on how we can really advance the momentum so that we can save and prevent cancer in cervical cancer now, because the time is now. So without further delay, Anuradha, can you tell me why is it so critical that we meet these WHO goals, and why now?
So thank you, Jenelle, for that question. For far too long, we have overlooked a colossal tragedy. And the tragedy is that cervical cancer claims the life of a woman every 90 seconds. And really what is sad about this is the fact that these deaths are entirely preventable. We have tools in our arsenal to actually fight HPV infections and prevent cervical cancer. Mm-hmm. So we have vaccines, we have screening, we can treat precancerous lesions. And what is really worrying is the fact that cervical cancer incidence and deaths are on the rise. And it is really younger women where this incidence is rising. They are at higher risk. So really, cervical cancer is now beginning to claim very young women when they are in the prime of their youth, because it's really women between 15 to 49 years of age who are at the highest risk. And these deaths, as I said, are constantly increasing. We are now beginning to see 350,000 women losing their lives every year to cervical cancer. And just one more thing to remember, that cervical cancer is first and foremost a disease of inequity, because 90% of these 350,000 deaths actually take place in lower and middle income countries. So if you look at cervical cancer incidence in low-income countries, the incidence there is 3 times higher than the incidence in North America, for example. But the mortality rates are 8 times higher. So in a poor country, the deaths are 8 times higher compared to North America. And that's just because those countries lack access to vaccination, and vaccines are highly effective in preventing HPV infection and cervical cancer, but also screening and vaccination, screening and treatment facilities are woefully inadequate. And as a result, we continue to lose more women. And just my last reflection is that if we do not act now, then by 2040, there would be 50% increase in the number of cervical cancer deaths. That means we lose a woman every 90 seconds today. We would start losing a woman every 60 seconds, and the global economy would lose $28 billion.
Well, thank you for laying the foundation of what we're dealing with now and why there is a real call for action. And I think as you're noticing here, you know, women are many times the backbones of the family and of the society. So as we are losing our women, that has impacts on our kids, on our parents, and just for generations to come. So my next question, how do we turn this around? What can we do? And we know this isn't just something we can address at the global level, but how do we get to the regional and local level where we can ensure that we don't see those numbers rise, as you have said, and we can make those goals that the WHO has set out for us?
So I think we have a tremendous opportunity, and this is really the moment to seize, because as you rightly said, cervical cancer is the only cancer that can actually be prevented and eliminated. And that is why in 2020, the world came together for the first time to really pledge to eliminate cervical cancer. And I think now is the time for us to walk that talk and really try very hard and seriously actually to achieve those goals. So what do we need to do? So there is this whole global sort of ambition, right? 90, 70, 90 targets and this whole cervical cancer elimination strategy. But action needs to happen at the local level. So what we are trying to now do is to build a consortium. We just launched the Global HPV Consortium in Kuala Lumpur on 5th of September, where we actually are trying to unify, you know, different actors and entities from multiple sectors behind this cause. And when I say multiple actors, what do I mean? Because typically the bane of global health has been that all of us are very used to operating in silos. But through this Global HPV Consortium, what we are trying to do is to topple those silos, tear them down, and say actors in immunization space, non-communicable diseases, cancer control, HIV, gender equity, reproductive health, adolescent health have to all come together, and we all must unify all change makers. So getting researchers, academia, practitioners, policy makers, decision makers, advocates, youth, adolescent and youth networks that we haven't really leveraged fully till now, women groups, right, at the community level. So these are the kind of change makers that we are coalescing and bringing together behind this goal of cervical cancer elimination. HIV is extremely important because there is a nexus between HIV, HPV, which is not fully understood, frankly. You know, data shows that women living with HIV actually have a much higher high-risk HPV prevalence, and they are at 6 times higher risk of developing cervical cancer. Cervical cancer among women living with HIV actually progresses very fast, 5 to 10 years, whereas in normal cases it is 15 to 20 years. So I think there are several connections here. So what we are trying to do through this consortium is to build new connections, you know, new conversations and new collaborations. And I really think that new age collaborations are going to hold key to our success.
What would be your hope? And it really is inspiring that you're bringing the consortium together. I was reading that was just launched in September, and I did see many of the people that you brought together come from so many different spaces. What was your hope that coming out of now UNGA today, this week, with all of these experts, I want to say a brain trust is in this room and online, that you would think the action, because like you just said, we need to now walk the talk. There's a lot of talk, a lot of awareness, a lot of paper, a lot of calls to action. Now we're at action. If there was 1 or 2 things you think we need to hold each other accountable, exactly, right? That we need to do. What would be your hope? And maybe at APEC or our next meetings where we're all together, we can look at this scorecard and say, hey, did you do this? Did you make this metric? What would you say we should do?
Yeah, so one thing that we heard at the consortium, and I must say that was a gathering of, it was a very refreshing gathering, and a lot of people said, There was new energy because we didn't have the usual suspects, but we really had local groups and regional groups and country level groups. So very different kind of people are talking to each other for the first time and really saying, okay, you are also working in the space we didn't know, right? So people are doing fabulous work, but they're just simply unaware of the work that is going on. So I really think that how all of us can really help move this agenda forward is by pledging ourselves to collaborating in ways that we have never done before. We sort of arrest ourselves in our own spaces, and we need to really tear them down and say, there are other people that we need to reach out to and try and understand their work. The second most important thing really is, and that again came out of the consortium where people said we are not making enough noise, right? So, and a lot of people said, even awareness about what kind of sort of body organ is cervix is very low. So a lot of people don't understand what is cervix, right? Where is it? So really sort of raising that awareness and making a lot of noise saying it is completely unacceptable that a woman should die 90 seconds or these deaths should continue to increase. And we have to continue to repeat this message again and again and again till everybody gets it. So I think this is really the time to stand up and act.
You bring a really good point here. As we know, across the globe, our political leaders, our governments, they are having to deal with so many competing interests right now, real difficulties. Do you have advice on how do we break through and make this the public health issue? And that what makes it really, I'd say, refreshing is we do have an answer, right? This is achievable. But getting our political officials, our governments to really prioritize this. Thoughts that maybe came out of the consortium from local leaders, because I think we know sometimes this is top down and down up, to build that momentum. Any reflections? So
there are 4 guiding principles, Jenelle, that we are following. One is integration. Right. As I said, nobody, no entity, no organization, no sector can achieve this single-handedly, by working in isolation. So the first thing is collaboration, integration, working together. So what we're trying to do under this consortium is to actually say that cervical cancer elimination strategy is predicated on 3 pillars. It is vaccination, but it is also screening and treatment. And now there is a huge opportunity, frankly, because in diagnostic space, so much of advancement is taking place. You can self-sample, you can self-test, and treatment ablasive methods are very, very easy to use. So really integration. The second is equity. As I said, equity, where are those countries which have a very high disease burden, but what are the populations like women living with HIV, marginalized populations, transgender people, right, who always suffer from negative gender norms and stereotypes. The third principle is heterogeneity. So I think really appreciating the fact that no 2 countries are alike or no 2 communities are alike, and how do we tailor and target our approaches to really meet the very unique and diverse needs of countries and communities. So that's the third thing. Fourth is sustainability, because everything that we do has to be sustainable. And for that, political will is really needed. So today, for example, after this, I'm going to this First Ladies of Africa event, where First Ladies of Africa are going to hopefully commit support to this consortium. So I think that is our way of really bringing in and securing a buy-in from the most important stakeholders who can help build political will. Because once we build political will, it brings in sustainable financing, and then together we can try and promote those cost-effective methods of service delivery that are really owned and driven by communities themselves.
Just one to drill down just in our final minutes here. You've spoken a lot about communities and the role of the local community. And I think we've had a lot of lessons learned during this last pandemic and other areas. Tell me a little bit more how you see that, what we should be doing as a global community with our local communities to really empower them. And I know you've had tons of experiences in different areas here.
So we have to flip the conversation and we have to flip the paradigm. I think we are very top down. So we are still in that mental mode where we are prescribing all the time at the global level. So all these targets, all these goals, or these agendas are set at the global level. And we sort of assume that communities are going to embrace them. Today, when vaccines, for example, are brought forward, to assume that vaccines are just going to be lapped up by communities is not correct anymore. Because communities are thinking communities. They are exercising choices today. They take their decisions based on certain inputs that they have. They have or they don't have, right? So I think it is extremely important for us to really now start to encourage operating models which are really bottom up. Where first of all, we go to communities and we start to listen. I really think at global level, our ability to listen is quite weak. So I think with just actively listening to what communities are saying and what their beliefs are, and then sort of trying to think about how we adapt our own response to meet the needs and aspirations of those communities is the way forward. Actually, at Sabin, we do this, and I love this part of Sabin's work, where we do a lot of social and behavioral research, and that research is designed in collaboration with communities, and that is how, for example, we surface some of the issues that transgender individuals and people with disabilities face during COVID-19 vaccination, and those are things that are easy to fix.
On those words, I don't know about all you in the audience, but I'm ready to roll up my sleeves. I feel the charge. I feel accountable to you. And I think we really do owe it to our communities, to our fellow citizens around the world, to have this call to action. We all need to work at this. We must respond, and we must listen and then act. So thank you so much today for your time. Community, thank you for your time. And let's have a call to action and celebration next year at this event. Thank you very much.
Thank you.